Hi, everyone, and welcome back to another episode of Mindful Marathon Conversations. I'm your host, Dr. Michelle Quirk. I'm a pediatrician and a run coach and the founder of Mindful Marathon, where I help make running easy and fun for busy professionals. And today I have with me a very special guest and a dear friend, Dr. Mitra Ayazifar. She is an ophthalmologist in California, one of my favorite states. And I'm just very happy to have her on the show. So thank you for joining us, Dr. Mitra.
Oh, good morning. Well, or whenever people are watching this, thank you so much for inviting me to be on the show. You are one of my favorite coaches, so and a true friend. I really
Oh,
appreciate this.
thank you. The feeling is mutual. So
Oh,
tell
thank
us a
you.
little bit about yourself, and we'll start from there.
Okay. So, I am in private practice. I have Capital Eye Medical Group, which is practice in Northern California with two locations, and I help patients develop their best vision so that they can live life fully and enjoy their hobbies for years to come. And through this process, apparently, I'm developing my best vision of my life as well. So.
It works both ways, right?
Absolutely, absolutely.
So maybe tell us a little bit about your journey with exercise and with your health. You have a very inspiring story.
Oh, thank you. So, for me, I was thinking, I have been thinking about this as far as the relationship, and I really think that having had an exercise routine um, really saved my life. What I mean by that is that about uh, eight and a half years ago, maybe 9 years ago, I was in the best shape of my life. I was doing, kickboxing class in the same taekwondo studio that my kids went to, and I was doing, kind of training to do 5Ks and also, half marathons, run, walk, and setting challenges for myself and just feeling really, really great about those challenges. And that way, I think I knew I was in tune with what's normal for my body, what feels normal, what doesn't feel normal.
Mhm.
And that was around the time where certain symptoms came up, and I noticed I was eventually diagnosed with ovarian cancer, which, as you know, that's one of the silent ones where we're unaware of it until sometimes possibly in the advanced stages. So I was lucky in that I knew what was normal and what was not.
Yeah, yeah. What kind of symptoms were you having, or when you were exercising, did you feel
Mhm.
like a general fatigue, or what were you feeling?
So no, it wasn't general fatigue. It was actually, kickboxing, the type of class that we had at the studio. It was a lot of, jumping up and down, lots of,
Mm.
almost like high intensity interval training.
Hmm.
And I would notice that during those sessions, I didn't have any issues like, almost like not incontinence, but feeling like I had to go to pee.
Yeah.
And but when I would just wake up in the morning and try to get out of bed, I noticed that I felt like, oh, I have to go and pee. I felt like, oh, well, that's odd because normally, if it's more because of after childbirth, years after childbirth, whether it's something with the bladder and everything kind of settling down after years after vaginal delivery, I thought, well, that's odd that it's happening when I'm really at rest, and
Yeah.
it's not happening with it's not stress incontinence. So what is it? And
Yeah.
that's what made me kind of go. I didn't have any fatigue, I didn't have any pain, none of that. I was lucky enough to be curious and know that that's just not normal
Yeah.
for
Thank God
me.
for that. Yeah. So
Yes.
you saw your doctor and you got this diagnosis, and then take us from there. What happened after that?
So after that, of course, I thought, once I have the surgery and the diagnosis, everything's going to be fine. I'm not going to need to go through chemo, but I did. So I went through, I was scheduled to go through 18 weeks or 18 rounds of chemo. And so one thing that I realized is that as a patient being on the other side, I wanted to keep things as normal as possible, as routine as possible. And for me, my normal was that I would, wanted to continue exercising, but of course at different, it wasn't the best idea for me to be in an enclosed environment because my system is immune compromised, and yet I wanted to be the old Mitra, right?
Yeah.
And so I continued to go to the studio again, not the kickboxing because I couldn't do that, but they would have spin classes in early in the morning before anybody was there.
Mm-hmm.
And there were maybe 4 or 5 of us, so everything was kind of spread out. The bikes were spread out, and I would go and do that spin class first thing in the morning. I had already shaved off the hair that was falling off. A couple of my longtime friends were there, so I would just tell them, hey, if I start falling off the bike, or if you notice me sliding off the bike, just
Oh
make
boy.
me upright and let me go. It didn't happen, but it was the best motivator, something that I was looking forward to. And I knew when I was too tired, or just had to give my body a rest. So it really allowed me to keep that routine and just feel good that I was still able to do that.
Yeah, yeah, that's amazing. Could you give advice, I mean, to anyone out there who may be struggling with maybe a new diagnosis or just going through a difficult time in terms of trying to maintain the routine? Like it's
Oh,
just a tough thing, but how to
I know.
maintain it through a difficult time?
I know. And obviously, I have my moments where we all have our moments where, or days where kids, work, other things take precedence, or we put it as a priority over our self-care
Yeah.
and taking care of ourselves. It's like, and the most important thing is for you to realize, especially as women, I feel like a lot of times, no offense to men, but I feel like we put that put that weight on our shoulders. And so make sure that you schedule your time, even if do whatever you can. I mean, for me, I'm not in the shape that I was then, but that's okay. I mean, this is what my body, hey, my body has hung in there throughout this time. So I adjust my schedule to try and fit in, even if it's 10 minutes of walking, even if
Mhm.
it's as you teach us, because I've been in your class and I've loved it. Walk, run. You don't have to run the whole way. You can fast walk. You can do little intervals. I don't know why in my mind I felt like, well, if I'm not running, that just doesn't count. Who
Yeah.
says? Do what you can and start with what you can. Just do as much as you can, and make sure that you schedule yourself into your day, into your calendar. It's so important.
Yeah, yeah. You know that I agree with all of that. I was going to say way back at the beginning when you were talking, you put the half marathon in quotes because of the run walk, but you didn't have to do that.
I know, but see, that's the thing. It's like there's that little voice that says, well, you kind of did a run walk. That didn't really count. Yes, it did.
It
That's like
did.
13.1 miles. No matter, it's the same distance, no matter how fast you go, it's still the same distance, right? Whether
Yeah.
you do an 18-minute mile, whether you do 11-minute, 4-minute, it's the same distance. You're still going the same distance. So just do your own. Run in your own lane, as you tell us to.
Yes, yes.
Run
Run
your own
run your own
race.
race. Yep.
Race.
I don't
Absolutely.
know, for a long time I told myself the same thing because when I started doing half marathons, I was also using run walk, but I don't know how many half marathons in finally I was like, well, I suppose I am a runner. I don't know, like how many do you need, right?
Exactly. I feel like, hey, if you make the commitment to do one, to train for one, you are a runner. You
Yeah,
are a runner. You're an
indeed.
athlete. You're a runner. Absolutely. Absolutely.
Well, I
I
love
have to
your
remind
tips.
myself.
Me too. Hey, listen, it's all a journey. Well, tell everybody where they can find you, and what you do for our eyes.
Ah, so you can find me every Monday morning. I do have Monday morning musings with Dr. Mitra. So that's on my Facebook page. But the best way to reach all of these sites is through my website, and that's www.mitramd.com or capital I Medical Group. That's my practice, and I practice general ophthalmology. So I help patients with their chronic medical vision issues, like exams for diabetes, treating glaucoma, regular eye exams, but also cataracts and cataract surgeries for patients, and of course eyelid surgeries, and for cosmetic and functional reasons. So doing all types of upper lid, lower lid surgeries for patients. So come find me.
Go find Dr. Mitra. Thank you for all that you do, and thank you for sharing a bit of your story and for inspiring us.
Thank you so much for helping me.
My pleasure. All right, everyone. Well, thank you for joining us, and we will talk to you soon. And I'll leave Dr. Mitra's links below. Thank you so much for joining us for this episode. If you liked it, please subscribe and share it with a friend. And if you are a newer runner or a runner who hasn't run in a while and you're looking to get back into the sport, you can find out how to work with me over on my website, which is mindful-marathon.com. See you on the next episode.